and a very good afternoon to all of you. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you must be keeping good health. Today we are going to discuss about our skin health with focus on psoriasis. Now, psoriasis is a condition in which skin cells build up and form scales and achieve dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, etc. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's a boon of blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Tushar Jagtap, who is a dermatologist practicing in Bandra, East Mumbai. He runs his own clinic from past 35 years. He's practicing here, Dr. Tushar Zen Clinic, located at 213 Amrut Nagar, Kherwadi Road, Bandra, East Mumbai. And he is also the convener of Healthy Hands, an association of doctors. He has years of experience in this field, and his skill and compassion have made a tremendous difference in patients' life. A very warm welcome to you, Dr. Tushar Jagtap. It's such a pleasure to have you with us.
Thank you so much. Thank you.
So, Doctor, today we are going to talk about something which we see in many people, which is psoriasis, a skin condition, but then many people don't know about it, exactly what it is, and in case they are developing such rashes, then why there is a need to go and consult a qualified dermat. But before that, because you also, run this Healing Hands, which is an association of doctor. What is your theory behind it? What is your, thought behind it?
Oh, so nice. So nice that you asked me this question. Basically, healing is multidimensional. When we think about doctors, we think about your illness and your treatment, and then you get all right with the treatment. So, in our concept, like when the doctors from Healing Hands, we think that we have to treat the patient in its totality. Like I talk about mental health, physical health, and emotional health, and even his social, environmental, and other health. If you see the definition of health by WHO, it encompasses all the aspects of human being. So, in our opinion, as a healer and as a doctor, it is inseparable. So, in today's times, especially in this century, if you see the traditional role of doctors, the doctors have always been the source of support, the source of care, and the source of inspiration to the society. So I think in today's times we need to re-invoke those attributes of being a doctor and being a healer. So we at Healing Hands believe that we offer you a complete well-being, which includes your
Amazing.
social health and your holistic health also. Thank you.
Amazing. So, because you talked about overall, well-being, why it's so important. So, today with our topic also, we would like to focus on the aspect of total well-being. Now, talking about psoriasis, doctor, what is it? क्या है psoriasis?
बहुत ही इम्पोर्टेंट टॉपिक है अगर स्किन में आप देखेंगे कि जनरल पॉपुलेशन के अंदर जनरल पेशेंट्स के अंदर अगर किसी एक चीज के बारे में डर है तो वो सोरियासिस के बारे में है बहुत बार ऐसा होता है कि पेशेंट्स को कुछ और शिकायत होती है और वो पूछते डॉक्टर ये सोरियासिस तो नहीं और आजकल जो हुआ है कि हम लोग वी आर लिविंग इन द एज ऑफ एआई वी आर लिविंग इन द एज ऑफ गूगल वी आर लिविंग इन द एज ऑफ so much of information. So
Right.
every alternate patient, when he reaches to the medical clinic, he has already tried to understand what is his problem is. And then psoriasis is one of the most feared after skin problem which dermatologists and doctors, general practitioners, all of us come across. So at the outset, I want to tell all the people who are logged into this platform and generalize and otherwise also,
Right.
please do not worry about psoriasis. Psoriasis is one aspect of skin problems. And one thing I want to make it very clear, most of the time the patient gives us a history that they went to so and so doctor, they went to so and so, clinic, and the doctors there at the outset said it is not curable. No, let me make a very emphatic and a very bold statement here. See, I've been practicing here for last 35 years. And I can tell you my experience. My experience is that I have got a fabulous, fantastic, and many of our colleagues have got a fabulous and fantastic result with patients with psoriasis, where 90 to 95% of the time, the psoriasis is there is a period of remission. And the remission, you can say 3 decades or more than that, it's sufficient or good enough to give me a confidence to say that psoriasis is manageable and psoriasis is treatable and psoriasis I can go one step forward and say it is curable. And then you ask me what is the question, what is psoriasis?
Yes.
Psoriasis, you have to understand, you sometimes patient get some patches on their body parts. They are scaly, they are itchy, sometimes they are red in color, and there are different types of psoriasis, and any organ of the body can get involved, especially skin, hair, nails. These are the commonest types. But psoriasis is also constitute a systematic disease because it is associated with something known as metabolic syndrome. And what is metabolic syndrome? Nothing but obesity, diabetes, hypertension, and dyslipidemia. We'll go into details of that, but you see the patches, itchy, recurrent, chronic, not responding to the treatment, coming back again and again, and it is irritating the patient. The patient is very much disturbed and is scared also because so much of information is available. People also scare them. The near and dear also says so and so thing happens with psoriasis. So psoriasis is a skin problem which is relatively recurrent. With I say relatively because with proper management there is a prolonged period of remission. So if you understand patches, rough, scaly, erythematous means little reddish in color, especially on the elbows you get, especially on the knees you get, there are various types of psoriasis. Like psoriasis vulgaris. Vulgaris means common. Gutted psoriasis, you will develop gutted psoriasis, multiple red drop type patches on the body, and that usually happens after a streptococcal infection, after you had some sore throat or something. Then there are psoriasis like psoriatic erythroderma. You can get this after suddenly if you have stopped the treatment or you have taken some medicines like hydroxychloroquine or chloroquine or lithium or some arsenic or gold. So like bhasma is very common in especially in our Ayurvedic product. So psoriasis, there are a number of types of psoriasis. We have primary psoriasis when the psoriasis begins below 40 years of age, and a secondary psoriasis after 40 years of age. So in nutshell, this is psoriasis. Thank you.
Right. So now we know what is psoriasis, and most importantly, it is treatable, it is manageable, and it is curable. Doctor, what causes psoriasis? It's an immune, thing. It's a metabolic thing, as you said. So, what are the factors that can lead to
See, it is
psoriasis?
a immunologically produced autoimmune. We say autoimmune
Ah,
disorder. And what is autoimmunity? Autoimmunity is a phenomena in which your own body cells they feel that the other cells of the body that it's foreign, and they say it is foreign, then there is something known as antigen antibody reaction. So your own body is killing your own cells, and when this balance gets disrupted and it lasts for a number of times, then you develop a lot of autoimmune problems, especially in skin. We see autoimmune problems in psoriasis and in alopecia areata and in other skin conditions, but primarily in these two. And then you have other system involvement, like in the respiratory system, you have a problem in gastroenteritis, you get irritable bowel syndromes. So many in joint and musculoskeletal system, you get rheumatoid arthritis, systemic lupus erythematosus. So multiple system involvement is there. Your own it's immunological driven, immunologically driven. HLA-B27 is an antigen which is incriminated genetically in psoriatic arthritis, especially. It can get triggered after psychological stress, trauma, post-infection, post-physical trauma, post-mental, emotional trauma. So these are the commonest causes of psoriasis, that it is genetically predisposed. If you have family history, you get psoriasis. Immunological phenomena is there, and the, as I said, infection, trauma, emotional trauma, and physical trauma. It can lead to psoriasis. Thank you.
Okay. Uh, Dr. Jagtap, who all are at risk of having psoriasis? Who gets psoriasis? And also, is it contagious?
No, number one, I should answer your second question first. I tell my patient, don't worry. When you want to shake hand with someone, go ahead and shake hand with someone. When you want to make some in the kitchen, you go ahead, because this is nothing. See, in psoriasis, what we have to understand, this is not contagious. Number one, and number two, remember, and the first question which you asked me, who gets psoriasis? This is an interesting question. Who gets psoriasis? If there is a family history of psoriasis, say less than 25% of the patient, they are likely to get. Remember, this is likely to get. Science is evolving. Knowledge is evolving. There is nothing hard and fast. No statistics I can say would be complete, or no knowledge is complete. And, because there is, as Erasmus said, there is no finality in thinking. So there is no finality in medicine also. So it is evolving things, and people predisposed family history is there. Then I have seen patients where there is a deep psychological trauma, and I would emphasize more on that. In my practice, I can tell you, I have yet to find a patient who did not go through a suffering, intense suffering, 3 or 6 months, or might 1 year before the onset of psoriasis, or before the onset of vitiligo, or before the onset of alopecia areata, which are all autoimmune disorders. So psoriasis is triggered by your psycho, physical, environmental, genetic, and immunological complex. So who gets psoriasis? If you have family history, genetically predisposed. And how does autoimmunity begins with? Autoimmunity begins basically, I would say, this mechanism of antigen antibody, it's or the cytokines activation, it happens. And this happens mainly if you are under too much of a stress, or you invite stress, or you are unable to manage stress. Thank you.
Okay. Now, doctor, for a layman, who don't know how it looks like, because what happens, most of the skin allergies, infections, etc., they appear to us as a rash. I'm talking about layman. Now, if they want to know that what is happening on their skin is psoriasis, and they need to go and immediately consult the doctor. Why? Because most of us run inside the kitchen to apply something on our skin, or most of us will go for some over the counter topical application to get rid of it. Normally, it takes us some time to go and consult a dermatologist when it comes to skin. Even if it is the largest organ, we are quite, lenient with our skin. We love to experiment a lot, home remedies. Plus, these days, because as you said earlier, information is there everywhere. We are flooded with information. We are flooded with what influencers are asking us to do. And not all the influencers over there who are talking about skin are qualified dermats. So my question to you is, what is that one thing that we need to see that, okay, this might be psoriasis and we need to go and consult a doctor rather than wasting our time over all this home remedies or, over the counter topical applications?
First and foremost, especially in the context of our country, I would say, when you get any skin rash, please don't think it is psoriasis. Number one. Why, Because the incidences in India is very less. It is less than 2.8%. Very
Okay.
less. But you find in Norway and in Denmark, the percentage of people get affected with psoriasis is more than 7 to 8%. It's very different. So from Indian context, I can go on the record to say that whenever you see any rash on the body, there are almost more than 400 causes of rash. If psoriasis may come in the last quarter, so don't think it is psoriasis. So first and foremost, you have to get over this fear of thinking that it could be psoriasis. No, what FDR, that is Roosevelt said, who was a president of America, three times president, he said that only thing we have to be fear about is fear itself. So don't fear. It is not psoriasis because the 98% of the chances of your skin rash is not psoriasis. Mind this
Right.
statistics: 98% of your skin rashes are not psoriasis. I'm emphasizing on this because we get many patients and they are in panic mode. इतने डरे हुए रहते, इतने सहमे हुए रहते कि उनको यही डर लगता है कि क्या ये सोरियासिस तो नहीं है, और ये सोरियासिस 98% टाइम नहीं होता है। तो आपका सवाल है कि फिर कैसे जाने ये क्या है? ये बहुत
Hmm.
जरूरी बात है कि कैसे समझे कि ये सोरियासिस है या सोरियासिस नहीं है। देखो, सोरियासिस होता है तो उसके पीछे आपको कुछ रैश रैश डेवलप, उसका डिपेंड्स। अभी आपके यहाँ रैश अगर डेवलप है तो उसके लोकेशन किधर है, साइड्स किधर है, वो कैसे दिख रहा है, वहां आपको इचिंग वगैरह हो रही है क्या, खास करके आपके जो एल्बोज है, नी जॉइंट्स है, बैक है, वहां होते हैं। और देर आर वेरियस टाइप्स ऑफ psoriasis. There are inverse psoriasis which you usually see in flexors area, especially in the groin, or in the intergluteal cleft you see, or you see below the ears also. So there are various types of the psoriasis. The best thing for, if you feel there is a rash, you should consult your nearby doctor. He can assess it better. So commonest rash we see here is hives, like urticaria, which we commonly
Hmm.
see. Or in Mumbai, we see lots of patients, they are suffering with skin infection that is known as, we call it a ringworm or fungal infection. So fungal infection and ringworm is very much common. Then psoriasis, and they are all treatable, including psoriasis. So please do not worry. So what you have to do, if you get a rash, preferably not to self-medicate, preferably not to apply unknown homemade remedies. It is okay that you can sometimes patients, they do try putting cold water or oil. So those remedies are okay, which is not going to damage, which are naturally accepted in our setup. But I
Right.
get a lot of patients. Yesterday I saw a patient who had applied, for some skin rash, he applied Derobin on the face, and his whole face is swollen. He has developed contact irritant dermatitis. So people are going to doctors by taking self medications or over the counter medications, or some unqualified establishment clinics, or I would not say people, and they get affected with that. So when you get a rash, natural remedies which will not harm you, and then you, it is advisable always to see a nearby doctor. Thank you.
Okay. Now, doctor, when a patient comes to you with psoriasis, for the diagnosis, what do you do? Just by clinical investigation, you're sure, or there are other tests, etc., to confirm?
No, you have to differentiate psoriasis from other diseases like Peters and parapsoriasis and trichosis and so on and so forth. So
Okay.
commonly with a dermatological setup, most of the time, the commonest investigation which we would like to do in a case is skin biopsy. And
Hmm.
skin biopsy is, it can be done at in your clinic, at a OPD on a OPD basis. That is one of the commonest investigation. And then something known as dermoscopy. Dermoscopy is magnification you get of the lesions. But one thing I would like to tell here, if there are doctors who have also joined in this program. So when you do the dermoscopy, please remove the scale and then see the lesion. So it is very easy to differentiate. And psoriasis, clinically, for us trained eyes, or even for doctors who are practicing for long number of years, it's quite easy. But these two investigation, one is, and if there is involvement of, you say, joints, then you can do HLA-B27 also. Then routine investigation like ESR we do, and since I said metabolic disease, then you have to rule out diabetes, dyslipidemia, then renal function test, and so on and so forth. But commonest investigations in psoriasis, like psoriasis, I said skin is a photogenic. You see, as a trained doctor, you see and you know. So biopsy and dermoscopy, these are the two commonest investigations which we could do, and most of us do. If because that's better, we get a 100% diagnosis about what is the disease, what is the problem itself, and the patient is also relieved. Thank you.
Okay. And what are the treatment options, doctor?
See, one thing you have to understand, why did I get this problem? I think before we go into what is the treatment available,
Hmm.
what is most important is that the patient's relatives, his ecosystem, and the doctors, they should have a very cordiality in the treatment. And in every patient, the treatment is a patient specific. Like it is a, we say, individualized treatment. Every patient is a different patient. We all are unique. So there is no flat this thing like you do this and you do that. No, when you see a patient, it depends on what is his age, what is his family history, what is his history of medicines he has taken, at what stage he has come. There is something known as psoriasis area severity index, that is PASI, that is PASI. PASI, or which how much body area is involved, less than 5%, less than 10%, more than 10%, more than 20%. Then there are grades of psoriasis. So accordingly, we grade the patient. What is involved? Sometimes scalp psoriasis is very common. Then you will get nail involvement also. You will get involvement of the skin also. You will get involvement of the joints also, and you will get involvement of the internal organs also. So it all depends on that. What is how the treatment is going to go, and what is our approach towards the patient. First and foremost, in treating the patient, the doctor and the patient, like what Khalil Gibran says. Khalil Gibran says when a patient comes to a doctor or doctor gives the medicine, both of them should be they should be on the same page or on the same wavelength. The patient needs to treat the doctor, and the doctor should have all the volition in him to treat the patient. And if he does that, I'm sure, and when when the other family members and other, they also help the patient to get all right. See, the patient develops psoriasis mainly because he has gone through a lot of emotional, physical, psychological, or environmental stress. I would underline this. Those who are listening to these things, you re-evaluate yourself. You reflect on your life. You reflect on your why did you get this problem. You ask yourself, कि मुझे ये तकलीफ क्यों हुई? And doctor's job is to explain to the patient, not the scientific jargon, but understanding the patient's life, mind, and then treating the patient. So the commonest, I would say, there are certain common things which we usually advise in the cases of psoriasis. Psoriasis is what it is a hyper proliferative problems. What is hyper proliferative problem? Our skin, every month we shed a lot of skin, so that is known as keratinocyte to corneocyte. The skin is shed. That is invisible because normally it takes 28 to 32 days for the skin shedding to take place. But imagine if you want to if you want to travel somewhere, ideally it should take 20 to 32 days, 32 minutes, sorry, 32 minutes, and you reach there within say 5 minutes, say 7 minutes, 8 minutes, or 40 minutes, or 22 minutes. That's what happens in psoriasis. The skin proliferation rate goes up like anything. It depends on the severity, and we call in dermatology or in our scientific sessions, this is known as epidermopoiesis. Epidermopoiesis means what? The skin proliferation rate goes over and above. So you lose normal skin structures. There is a lot of itching. There is a lot of scaling. There is erythema. And when you take medicines, it gets better with some of the local creams and lotions and ointment and creams. But again, it recurs. Now here comes the patients and the family's role into account and the doctors. Why does the recurrence take place? I think this is one thing which we all have to understand when we treat psoriasis patients. What are the triggers? If you address the triggers, there are environmental triggers also: excessive cold, excessive heat, pollution, patient's lifestyle, fast track life, sedentary life, and most important, the information which the patient is receiving from various sources. We have been misled by them. Now I see on, say, social media, like they will promote something as if that is panacea for everything. You take this and this problem will go, and there will be reels or there will be videos, and so many people will try and draw your attention, and where your attention goes, that thing goes in your mind, and you start ruminating and you start working on that, And with that, what happens if you are on the negative track, then you will continue to get negative effects. You will continue to suffer. So best thing about today's time is that you have to take advice from the right source and from the qualified people, the specialized people from that area. Suppose if I have to go for my accountancy filing my returns, I have to go to a chartered accountant. I know everything from Google or ChatGPT how to file returns, but who is studied that is chartered accountancy. Same with the lawyer, same with other specialties. So the patient should never treat themselves. And what I was saying is that you have to understand yourself why I'm getting this problem and how it will get all right. So to that, it is an individualistic treatment. And in this individualistic treatment, there are 4 or 5 things. If you want to ask me something, I will stop here and then again I'll continue. Thank you so much.
ओके सो डॉक्टर बहुत अच्छे से आपने समझाया कि किस तरह से ट्रीटमेंट होता है और ट्रीटमेंट सिर्फ हम कहें तो वो नहीं है जैसे आमतौर पर एक मरीज जो है ट्रीटमेंट समझता है कि हम डॉक्टर के पास गए हमने दवाइयाँ ली या अगर कोई प्रोसीजर है वो कराया और हमारा ट्रीटमेंट हो गया ट्रीटमेंट हैज टू बी होलिस्टिक यू नो और यहीं से मेरा वो सवाल जो शुरू में मैंने आपसे पूछा था बिकॉज यू ऑल्सो रन्स दिस healing hands which is an association of doctor how important because you know throughout this conversation you have also emphasized on the fact that people are very scared of this term psoriasis ये नाम सुनते ही वो घबरा जाते हैं स्किन पे कुछ दिखता है तो उनको लगता है कहीं ये सोरियासिस तो नहीं और आपने कहा कि इट्स वेरी इंपॉर्टेंट कि हमारा फिजिकल वेलबींग के साथ हमारा मेंटल वेलबींग भी हो यू बिलीव इन ओवरऑल यू नो वेलबींग ऑफ एन ह्यूमन तो वो कितना जरूरी है हाउ इम्पोर्टेंट इट इज टू मेंटली ऑल्सो यू नो काउंसल द पेशेंट कि वो घबराए ना और जब हम मेंटली एक उस पे रहते हैं कि हाँ ठीक है ट्रीटमेंट करा रहे हैं सब ठीक हो जाएगा दैट पॉजिटिव ऑरा यू नो हाउ मच दैट हेल्प्स अस टू रिकवर फ्रॉम दिस
I would say that is the most important aspect of treatment, that the patient himself or we all depend up, it all depends on the understanding of the patient.
राइट
How much you can understand what the doctor wants to communicate to you. And so there are various means of approaching the patient. There are not necessarily all the patient they would understand, but there are certain modalities the patient doctors can invoke. Like one thing I will tell all the patients all the patients who say they are having psoriasis. Moisturizing your skin is the most important aspect of psoriasis. Number one. Number one is I will underline that. Moisturize your skin with a proper moisturizer, proper emollient. Emollients are so good that they take away 70 to 80% of your problem. And you get itching, you get scaling, everything goes down when you emolliate your skin. Apply moisturizer. If you don't get anything, apply your coconut oil if you're happy with that. And it makes difference. Then local creams. In local creams, there are certain creams like say mild, moderate, and a potent steroid creams. It all depends. If the scalp is involved, then it is better to use lotion because then the spreadability of the lotion is proper. And if the body surface is involved, then you can use creams and ointment. Okay. So that is how the treatment start. Moisturizer, mild, moderate, or severe depends on the severity of the problem, the area involved. Local steroidal cream, and there are other creams like vitamin D analog which we give. Then there are tacrolimus, pimocrolimus, that is also. But I would say basic is moisturizing and using mild steroidal creams. That helps with counseling, with hydration, with vitamin D, with vitamin C, with antioxidants. I can tell you, I have a patient. I must discuss this case here, and the many patients who are scared of psoriasis, they will understand. This young lady, she had received, 40 injections of psoriasis from some place. Every month she used to go, every week she used to go and take injections. And when she came to me, I saw her. That time she had all puffiness of face, and her body was almost, she had become swollen. So then I explained her and then stopped that remedy. And then today, after a gap of say 1 to 1.5 years, she is, I have asked her, you tell me what you feel better with, which treatment I have prescribed you since the beginning, what you're comfortable with and you are happy with. So what she is taking right now is vitamin C tablet, local moisturizer, and a very mild form of steroidal lotion. And her body surface area was more than 80. That is a severe psoriasis. You can say she had psoriasis from scalp downwards everywhere, every aspect. And she did well without systemic steroids, without immunomodulators, without recent medicines like biologicals, or even I would say anti-metabolite like methotrexate and all. She had taken all that in the past, except biological. She had taken everything, all cyclosporine and so on and so forth. And she had developed a lot of problems with that. What was important in her case, her approach, her attitude. She was little impatient in everything. Little very impatient, very you can say she my way or no way. So this
Ah,
my way or no way usually creates lots of problems because we have to all of us have to be very flexible in life, very flexible in various aspects of life. So we really have to in Japan they have a nice technique, nice technique that is known as wabi sabi, and that is what is wabi sabi. And this is what the patients, all the patients, they should understand. Your problem is not permanent. That is wabi sabi. Nothing is permanent. Nothing is complete. Like neither I am complete, nor the other person is complete. Neither this is complete, neither that is complete. And nothing is permanent. Nothing is complete. Nothing is perfect. We have to accept imperfection in us. We have to accept imperfection in others. So the whole idea is acceptance. You accept, yeah, I have this skin problem. It doesn't matter. It is not permanent. It is going to go. So once you start imbibing this positive thought process in you, and the doctor gives you that line of a approach, so you start getting better results, and you start trusting the patient, and the patient need and must necessarily trust his physician. Okay, see, we all go through. I will say nobody is complete, nobody, nothing is permanent, nothing is perfect. But these things now you have to start asking and you have to start operating within this framework. I tell you the results are phenomenal. Thank you.
right. So, yeah, attitude is very important. What is your attitude towards the treatment process? That is equally important. Because you also mentioned about vitamin D, doctor. Another question which commonly viewers ask, can the sun help in psoriasis?
Yeah, sun does help. Depends at how much phototherapy you take, and it helps like vitamin D in reduce. It is antioxidant and it reduces the inflammatory chemical messengers like we call them cytokines. And there are say certain cytokines like interleukin 17, 23, 1, 6. They are involved in pathogenesis or immunology of psoriasis. What is cytokines? They create inflammation, and that is why you have this number of molecules. And vitamin D does help, sunlight does help, vitamin C helps, number of other antioxidants, they also help in the help in managing the patient, managing patients with psoriasis. Most importantly, five things a patient should do is hydrate himself or herself properly, drink enough water, do mild exercises, take quality sleep, don't overthink, don't get nervous, don't get anxious. Anxiety is a commonest form of what is anxiety? Anxiety is fear or worry about something or someone which happens repeatedly and it starts affecting your day-to-day life. Anxiety is the no for psoriasis treatment. Don't get anxious, don't get worried about psoriasis. If you get worried, if you think more about your problems, the problem takes longer to go. We tell our patients that please don't think about your problem too much. Think as much as it is required for. Like we say, apply not too much, not too less. That is a middle path. Approach your problem with a golden mean, and you would understand that your problem goes down. So vitamin D does help. Phototherapy or sunlight does it. Thank you.
Okay, doctor. And doctor, would you also like to shed some light over psoriatic arthritis?
Yeah, psoriasis arthritis is like, see, there is involvement of small joints primarily, and those joints they get affected. And then, if it is not treated properly, you can get deformities. So psoriasis, psoriatic arthritis is one of the commonest, you can say, a problem which is debilitating, which really makes patient debilitated, and it is that is why early diagnosis, early treatment, lifestyle modification, and taking right treatment from the right source is very important to prevent the complications. In psoriatic arthritis, like you get in rheumatoid arthritis, there are changes in the bones and the joints, and the chronic inflammation leads to number of complications, and you get debility, and in long run it causes much more problem to the patients.
Okay. I'll take few questions that our viewers have asked. So Lucky Sharma is asking, Doctor, are herbal treatment effective for psoriasis?
Excuse me. Herbal treatment depends. Like say, I see one a very senior gentleman who comes on the television with saffron robe, and he talks about treatment and query. What I say, na, say what is good advice from that, take that advice.
Hmm.
Okay. Herbal treatment, we India, we have, or almost every civilization, they have these plants, and they have its medicinal value. So depends what sort of local treatment, like locally we apply some herbal treatment, then something which you are asked to take, like there are certain medication. Spirulina, it's very good. Spirulina help. And what does spirulina do? It is it is something which was which is derived from algae, and it is used by astronomers, and it has got an effect. And what does spirulina do in skin? It has antihistaminic effect in long run. I do use that in chronic urticaria, chronic pressure. So yes, herbal treatment from which source, which place, and how it is to be taken, how it is to be applied depends on that. And I don't say that it does not have effect, but we have to, we have to take other pathies, other information also into account. Thank you.
Okay. And Dr. Jagtap, before we sum up the whole session, any take home message for our viewers?
Yeah, I would say the three things or four things that the viewers should do is give some time to yourself. I ask question to my patient, how much time you give to yourself? Believe me, 90% of the patient, they really don't understand what does that mean. So give some time to yourself. My time, me time. That is most important. Do at least 1 minute meditation. No substitute to meditation, I'd say. And what do you do meditations? I think I'll just show here that what I ask my patient, sit upright and just close your eyes for 1 single minute. In the morning, 1 minute, and in the evening, 1 minute. The moment you do that, when you are sitting actively and you are closing your eyes, what happens in the brain? Now, whatever discussion we had so far, that was our beta waves in the brain. They were predominant. And the moment you start, relaxing, you get into something known as alpha state. And this alpha state is what we need to cure the patients, and is what we need to make ourselves, fit person, both mentally, physically, and emotionally. So this knowledge is to be, shared with the patients, and I do that when I find this patient need. Uh, so my takeaway message is: eat properly, have a balanced diet, do meditation, do moderate exercises, take good sleep, don't overthink. And psoriasis, take this open. You 98% of the time, whatever skin rash you see on your body is not psoriasis. I think this one statement is very important. That 98% of skin rash which you see on your body is not psoriasis. That should alleviate your anxiety. Am I right, Miss?
Absolutely,
Yeah. So
absolutely.
my takeaway message is that whatever rash see on your body, don't think it is psoriasis. 98% of the time, it is not going to be psoriasis. So on this note, I say relax. Don't don't worry too much. We all need all emotions in right degree, at right time with right person. Huh? We all need that, all emotions. And if you manage yourself, if you manage your physical, mental, and emotional health, don't get panicky at all. Don't get panicky. Don't get scared. Today I see patients, they get scared so much. And a patient yesterday, I saw her. She came with her father, 18 years old teenager, and she had queries about PCOD. And when after finishing with her father consultation, then when I started and said something, and there were tears in her eyes because she was so scared. And I said, don't worry. She's clean, trim, and just 18 years of age. But she has read so much on the Google or on
Yeah.
through ChatGPT or other modes. And she was scared. So that is the whole thing I would aim and summarize with this. Number one, I want to thank all those who have joined here, or all those who will see this program in the future, to you and the organizer for giving me an opportunity here. And this is gratitude which I have to express to you and everyone. And I say, what is important is develop your soft skills and be happy. Don't worry. Thank you.
Thank you so very much, Dr. Tushar Jagtap. As always, it was wonderful talking to you, and thank you for making this whole topic so easy to understand for us. और जैसा कि आपने कहा, घबराना नहीं है. हर रैश सोरियासिस नहीं होता, ज्यादातर केसेस में नहीं होता. तो ये मेरे ख्याल से एक सबसे सुकून भरा स्टेटमेंट था जो हम व्यूअर्स के लिए था. थैंक यू सो वेरी मच फॉर टेकिंग आउट टाइम फ्रॉम योर वैल्यूएबल स्केड्यूल, your busy schedule. And I'm sure now people will also, use this information to prevent themselves and their near and dear ones from getting psoriasis. And in case if they get to see such symptoms, signs, they now know that instead of self-medication, it's always better to approach a nearby dermatologist. And we really look forward, Dr. Jagtap, for many more such sessions with you in coming times. Thank you
Yeah.
once again.
Thank you so much. Thank you, everyone. Thank you.
And viewers, thank you for your participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.